Hi, everyone. Welcome to episode 14, Planet Health Project. I'm Shannon Burford, your host today, and we're very blessed to be joined with Brad Parkinson here.
Hi,
He's going to
Shannon. How
share
are
with.
you?
Hey, how are you?
Good.
Brad's going to share with us the topic of acne. And Brad, can you tell us a little bit about acne for those people suffering with it out there?
Yeah, look, it's a very common thing we see in clinic, whether it's hormonal acne, acne rosacea. We won't talk about that as such. That's a little bit of a different condition, but this is more acne vulgaris, where it's a bacterial involvement as well as oily skin are the main components. So it's very common in my clinic. I assume you'd see it a lot too yourself, Shannon. Would I be correct in suggesting that?
Yeah, and it's heartbreaking. Whoever comes in and they're really struggling and they're obviously using these washes or they've tried some antibiotics and
Yep.
Because it's on the skin, they're really struggling and desperate. Please, what more can I do?
Yeah, this is it. And they often come in desperate. They've often tried antibiotics and they're using all different topical applications that can maybe get some temporary relief, but quite often dries the skin out further and complicates the situation. So yeah, acne vulgaris, it's basically a bacterial involvement that is exacerbated by the oily skin, and it's a I won't necessarily say complex issues, but they all kind of tie in together. And one of the two main culprits I find are dairy and sugar. They tend to fuel this skin issue, and basically high androgens as well. So what we tend to find, if there's poor detoxification and elimination, so the liver's not doing its job quite as well as it can be, the lymphatic system's not doing its job as well, and then there's poor skin microbiome as well as imbalances there, bacteria, and you're getting the acne bacteria that's dominating. And so what can happen with poor detoxification elimination is that we can see an increase in androgens, and stress can drive up androgen levels, which can drive up testosterone, which converts to DHT, dihydrotestosterone, and then that increases the size of the sebaceous gland, and increases the production of oil. And then quite often what people will do is use oil-based creams as well. And then you've got this oily skin. This coupled with the bacteria, which can be from poor hygiene, but quite often it may start that way. But these people are really in desperate situation. They'll really be cleaning themselves and potentially over cleaning using high chemical based products, and that combination of the bacteria and oily skin will cause the acne. Now what makes this worse is dairy products. They'll have something called IGF in there, insulin growth factor, that will increase that androgen level. They increase that conversion of testosterone to DHT. Also things like sugars will, high GI foods will also increase IGF, which will have that constant flow on effect. So that's, in a bit of a basic nutshell, that's kind of the mechanisms involved there. Yeah, it's really problematic and very common in clinic.
Yeah, in a nutshell, Brad, in a Brad knowledge jam-packed full spiel. But probably you would find someone comes along to your clinic and they've got this acne all over their face and they're desperate, and I would be the same, and I was as a teenager. Give me a fix now, and that's why they may reach for the soap on the shelf, and you want it fixed now. But as you and I know, it's a multifactorial thing that takes working on and looking at the long-term goal.
Yes, definitely.
So that's the basis of what it is, but how do we kind of unpack it and then understand more specifically for that patient So what's some tips that they could do to help them understand of areas to focus on?
Yeah, well, this is important too because, like we said, they've often been, prescribed Roaccutane in the past or doxycycline or something like that, and these things can really mess up the liver, have real catastrophic consequences, especially long-term use. So quite often they'll come to us and they might have their liver not working well, and that is a big component of the detoxification process. So obviously looking at any liver tests we can do. Then there's the hormones, as I was mentioning, the testosterone or high androgen levels, testosterone converting to DHT, and knowing where estrogen, progesterone's at with females, and knowing upstream the luteinizing hormone, FSH, where all that's at. So something like a Dutch hormone panel can be really effective at finding out where all their hormone levels are at, and it can often reveal other things going on, if their cycle isn't regular or anything like that as well. And then the big one is glucose testing or glycated hemoglobin, just going, looking at where they are with their sugar load and hyperglycemia or hypoglycemia. So understanding that is very important because that'll give us a good indication of how much that's contributing. And generally what I find with different patients, they'll have different levels of these things going on at once. And it's not just there's a one fixed cures all with this this problem. And then sometimes you'll get that classic hormonal picture on the jawline, sometimes the T presentation, and then sometimes along the back as well. So these things we need to take into consideration too, how we proceed further. But yeah, mineral imbalances are very important, and doing something like a hair mineral analysis might reveal some imbalances there with the minerals, but also reveal any toxins. Like I did one just recently, and titanium was through the roof, and titanium dioxide, I think it is in a lot of the mineral based makeups, which I'd often recommend. But it's interesting to know that even the mineral-based makeups can increase that sort of toxicity as well. So yeah, looking at that, I think that's iron levels. Iron's always important as well. So yeah, there's many tests we can have a look at and get some information, valuable information, and of course, good case taking as well.
Yeah. You could spend always thousands of dollars on testing, but good listening skills and listening to the person in front of you can help a great deal.
Yeah, definitely.
Yeah. And then so we get some results back and we find particular things with sugar or minerals, etc., as you explained. And then what do we do? So what's the treatment? So can you dig? Of course, it's really complex, and we'll try and summarize it down and give the nuggets of gold to the viewers out there. Yep. But can you dive into the treatment, diet, and other things?
Definitely. Look, we're always trying to work with diet, so we really got to reduce that dairy down, and if we can get them completely off dairy, that's fantastic, and the sugars as well. And sometimes we can go in with different herbs and nutrients, whether it's your chromium, things like it could be fenugreek, it could be gymnema, it can be cinnamon. These things can all be added into the equation depending on the individual to balance blood sugar levels, but ultimately we want to reduce the intake of those sugars, or at least increase the fiber intake, and the timing of when they're having certain foods as well is very important too. Obviously hygiene, and like I said, most acne sufferers will be onto that at some point, and then go the other way and be using soaps that are chemically based and so forth. So we want to get rid of those topical applications. Even people using things like sorbeline and this sort of thing as a moisturizer can really have a negative impact too. So it's getting them off those things. And if they're using something topically, I like my tea tree based topical applications. They tend to really control the bacteria load on the skin without damaging the skin too much. And keeping that skin microbiome pretty well balanced too, which is important too. So we don't want to just go in there, destroy everything and kill everything, because that's not going to be the answer. We want to create the best environment for a healthy skin. And then there's all your nutrients for building healthy skin too. You know, your collagens, your vitamin C, your zinc. And vitamin A can be beneficial depending on the individual as well. So we want to make sure that we can supplement with those things, but also that they're coming in through the diet, importantly as well. And if hormones are out, which is often the case, then there's specific herbs that can come in there and modulate those hormones, balance those hormones as well, or upregulate certain hormones, downregulate others. So, you know, we've got a lot of tools at our disposal being naturopaths, and there's a lot we can do there. So, yeah, I think that's quite a few. So with the herbals, we're sort of talking about your lymphatic herbals, ultrative herbals, which are really good skin cleansers. So for people that don't know, the lymphatic system sort of is the drainage system underneath the skin, and that's where all the waste gets dumped, and we've got to make sure that lymphatic is working effectively. Herbs can help assist this, but, you know, keeping your fluids up, exercising regularly, movement is key here to get that waste through the system. And then all that waste that's generated and getting through the lymphatic system, we also need to support the liver in doing that too, and supporting that as well. So yeah, there's plenty we can do as naturopaths, that's for sure. And, you know, it can be the basics of just sugar and dairy, but there's a lot else going on that we can support in different parts of the process.
Excellent. That's fantastic. There's so much in there. I would have to rewind it and watch it a couple of times and take notes. And something I'd like to add too is if someone's doing it and they're cutting the dairy out and they're trying their best to get the results, sometimes they may find that it actually gets a little bit worse, or they're disheartened because they're making these changes and nothing seems to be happening. But I'd like to say hang in there, because sometimes initially it gets worse. It might take a couple of weeks for you to really notice the difference. So hang in there.
Yeah, definitely. I think that's a very good point, Shannon, because like managing expectations is part of what we have to do as well. And I think what people are used to, especially when they've been given like Roaccutane or something that might have reduced the acne to a certain degree initially, or they've been given the contraceptive pill to sort of manage hormones, and they get these pretty quick results, yet they're not sustainable long term and actually can be detrimental long term. So they come into using natural therapies, and if they have that same headspace of, okay, give me this to fix that, and they want it fixed immediately, then they're going to really miss the whole point. What I always encourage my patients to understand is that what we want to do, we don't want you to take you, say an acne patient, for example, comes in and they're really high sugar, lots of dairy, and their hygiene isn't great. Well, you know, you could, that's the ideal easy acne patient, because you just stop those three things and then they eventually come good. But if they come in with all that, and the ideal scenario is, you know, that's them there, and the ideal scenario is them over here, we don't want them just to say, you can't do all that, you've got to do like that. And what will happen is a yo-yo effect. They'll might go extreme cold turkey and stop all those things, stop the dairy, stop the sugars, and have plenty of water and all this stuff, and then they'll do that for a week or two, and then they'll slingshot back. So it's about making those incremental changes, just creeping along, making those permanent changes and keeping them going the right direction. And this is important, because if they can do that bit by bit by bit, they stay going in the right direction, and they'll get to where they need to get to. Rather than looking at it as a temporary change, that's going to fix something, and then they can go back to old habits, then that's never going to work. They need to make those permanent changes, and doing it bit by bit, and it's a permanent change each time, as well as while we're treating everything. And look, the blood cell turns over in 120 days. That's 4 months roughly. These are the sort of things you've got to think about when we're looking at changing your physiology. It takes time. It takes 3 or 4 months to get those ideal results. Doesn't mean we're not going to get results within a few weeks. Generally when we start prescribing stuff, people feel better naturally because the energy levels rise, they sleep better, they get all these other beneficial side effects from the treatments. So you certainly get some benefits pretty quickly, but getting the ideal results for treating the acne, you've got to look at that more long term.
And also it's for the greater you, other areas of sleep improvement, fertility improvement, energy, as you say. And it really aligns with Brad and my vision of Planet Health Project of permanently changing the health for the better of the whole globe. So by improving your acne and improving your whole health, you'll live a much longer, happier, healthier life. And that's what it's all about.
Definitely.
Yeah. So is there any last closing words or hints or remarks, Brad, that you'd like to share?
Look, I think we covered a lot of it. Keep your fluids up, get off that dairy and the sugar, and manage your stress too. It's we always say that, but it's a definite thing to do here. Even things like your clothing and your bedding and everything, make sure that you're using those things that aren't going to be disturbing your skin balance or your skin microbiome either. All the synthetic fibers and everything that you get in contact with can be irritants as well. So they use the natural cottons. If they can even get things like hemp sheets or bamboo or what have you, then that's all going to help in the long term.
Excellent. Thanks, Brad. So where can everyone find you, Brad?
They can find me at www.bradparkinson.com.au and Brad Parkinson Naturopath on Facebook.
Excellent. And everyone can find me at Cura Medicine, CURA medicine.com.au. And thanks for watching, and stay tuned for the next episode 15 coming soon.
Thanks, Shannon.
See you, Brad.
Bye.